Taking the recommended quantity of selenium can help lower thyroid antibodies and protect your thyroid gland. If you want to avoid this, here's how much you should be taking. Taking too much might actually worsen your thyroid gland and raise your risk of acquiring diabetes. Individuals suffering from Hashimoto thyroiditis should strive to consume 150 milligrams of selenium daily. The lengthy response is a bit more intricate and subtle, but it's important to know if you have a thyroid condition because there is a genuine risk of taking too much, which is readily preventable. Before you start taking selenium, let's make sure you understand why you need it, what form to take, how to avoid taking too much, and how to determine whether you should take supplements at all. Let's jump in. Patients with Hashimoto's disease love taking selenium for one important reason. It protects the thyroid gland from oxidative stress, which means that if you have autoimmune thyroid disease, you will have less inflammation and damage to your thyroid gland. It does this by assisting your body in producing glutathione, a master antioxidant. However, because selenium is incorporated into selenium proteins, it also helps your body use and activate thyroid hormone. Taking it also helps target and reverse the underlying cause of Hashimoto's disease, which is immune dysregulation and thyroid gland inflammation. This helps you understand why all of this works. Given this, it should not be surprising that a number of studies have demonstrated that consuming selenium helps lower thyroid antibodies. Nonetheless, these findings presuppose a few crucial ideas. The first is that those using selenium genuinely require it, and the second is that they are not unintentionally taking more than they require, meaning they have the proper dosage. For these reasons, we need to take a moment to talk about dosing. Unfortunately, thyroid experts have been inconsistent in their recommendations regarding selenium dosage. Even a few years ago, it was common for them to advise patients with Hashimoto's disease to take doses of 400 to 500 micrograms per day, rather than the recommended daily allowance, RDA, which is set at about 55 micrograms. So if you're enjoying the content, please hit the like button, subscribe to our channel, and share your thoughts in the comments. Your support truly helps us grow. Now, let's get back to the video. Since many of these experts saw the studies showing that selenium supplementation correlates with the reduction in thyroid antibodies, these recommendations are about 8 times higher. They were based on a few studies that suggested taking these higher doses might be safe. At the time, they seemed like a good idea, but they all overlooked one crucial factor: the risk that excessive selenium supplementation poses to diabetes. Numerous research conducted in recent years, including a meta-analysis including over 47,000 patients, have demonstrated that the risk of diabetes rises in tandem with blood selenium levels. Patients with Hashimoto's disease who wish to take selenium supplements face significant challenges because having a thyroid condition in the first place increases the risk of developing both diabetes and insulin resistance. In fact, the baseline risk is 2 to 4 times higher than the general population. For perspective, this risk in diabetes is seen with doses of selenium ranging from 125 micrograms to 200 micrograms, which is only half of what the thyroid experts recommend for thyroid patients. As I stated at the beginning of this video, it may actually be the case that some thyroid patients with Hashimoto's disease are taking selenium to help their thyroids while also unintentionally harming their pancreas. For this reason, I advise using smaller doses of selenium, between 75 and 150 micrograms, to achieve all of these pro-thyroid benefits without needlessly raising your risk of developing diabetes. After all, why is it such a huge concern if you are already taking selenium? Let's discuss how to determine if you are taking too much. You can consume a metric truckload of this substance and not really worry about the potential of developing toxicity because, in contrast to other micronutrients, selenium toxicity is not that uncommon and poses a genuine hazard. If you take even 10 to 15 times the RDA of selenium, you may begin to experience the signs and symptoms of selenosis, which are a major problem for thyroid patients. In fact, the thyroid B complex contains 125,000 per of the RDA in the form of vitamin B12. But these levels do not cause toxicity and are actually very well tolerated by thyroid patients, since they frequently resemble the symptoms of hypothyroidism. For instance, some of the symptoms linked to excessive selenium intake include hair loss, fatigue from fragile nails other than the GI-related side symptoms, nausea, joint discomfort, and unsettled stomach. In certain cases, patients with Hashimoto's disease who take high doses of selenium, 400 to 600 micrograms per day, may be exacerbating the symptoms they are attempting to treat. Symptoms like fatigue, brittle nails, and hair loss are exactly the same as those you might experience if your thyroid is low. It can be challenging to determine whether you are taking too much selenium, but if you believe you are, the best course of action is to simply stop taking it. This will allow your body and kidneys to process out the excess selenium, and your symptoms should go away. In terms of sources, should you focus more on food or supplements? Additionally, when you combine this with the fact that there is an increased risk of diabetes at these higher doses, the lower doses that I recommended start to become much more attractive. The response is that organic sources of selenium, such as selenomethionine and selenocysteine, are constantly present in supreme food. Whereas selenocysteine is mostly found in animal sources, selenomethionine is mostly found in plants and vegetables. Inorganic forms of selenium, such as selenite and selenate, are frequently found in low-quality supplements. However, because of their poor bioavailability, these should be avoided. The good news is that some supplements contain these organic forms of selenium, but you should always aim to obtain as much of it from your food as you can. Why? Because it will make you consume more whole foods, which will help your thyroid and your health in general. If you want to acquire your selenium from your diet, try turkey, shrimp, and tuna, which are the highest plant sources. On the other hand, Brazil nuts are a source of selenium. However, because of the variation in selenium content among Brazil nuts, I generally do not advise using them as a primary source. However, if you were to use them, 1 or 2 Brazil nuts should suffice to meet the majority of your selenium requirements. I advise you to try to obtain as much selenium from your diet as you can. Moreover, if you're struggling, use a supplement to compensate. If you're taking selenium, make sure to check the back of the supplement facts panel to see how much and what form you're taking. If the ingredients don't state that you're taking selenium, methionine, or selenocysteine, then throw away that supplement. By the way, there are other supplements that have been shown to lower thyroid antibodies. In conclusion, taking selenium for Hashimoto's can offer significant benefits for those managing this autoimmune thyroid condition. Research has shown that selenium may help reduce inflammation, support thyroid function, and even improve the overall quality of life for individuals with Hashimoto's. By incorporating selenium into your daily routine, you could potentially experience enhanced energy levels, better mood stability, and improved thyroid hormone levels. However, it's essential to approach any supplement regimen with caution and to consult with a healthcare professional before making any changes. Everyone's body is different, and personal health needs can vary widely. At Health Angel Solutions, we're dedicated to providing you with the latest insights and strategies for optimizing your health. Remember, our goal is to empower you with knowledge so you can make informed decisions about your well-being. If you found this information helpful, please take a moment to like this video, share it with others who might benefit, and subscribe to our channel for more content on health, wellness, and holistic living. We're here to support you on your journey to better health and to keep you updated with valuable resources and tips. Your engagement helps us grow and continue to provide quality content. Thank you for being a part of our community, and we look forward to bringing you more helpful insights in our future videos.